This medicine is used to relieve moderate to severe pain. It works on specific parts of the brain to provide pain relief. This medication is classified as an opioid analgesic. Before using morphine sulfate suppository, Rectal, make sure to read the medication guide provided by your pharmacist. If you have any questions, consult your doctor or pharmacist. To use the suppository, unwrap it and insert it rectally as directed by your doctor. Lie down on your left side with your right knee bent, and gently push the suppository into the rectum with your finger. Remain lying down for a few minutes, and try to avoid having a bowel movement for an hour or longer so the drug will be absorbed. Remember, the suppository is for rectal use only. The dosage of this medication is based on your medical condition and response to therapy. Pain medications work best if they are used as the first signs of pain occur. If you wait until the pain has worsened, the medication may not work as well. You may also take long-acting opioid medications or use opioid patches for ongoing pain if directed by your doctor. In that case, this medication might be used for sudden, breakthrough, pain only as needed. Make sure to follow your doctor's or pharmacist's instructions for safely using other pain relievers and ask them about using morphine safely with other drugs. Suddenly stopping this medication may cause withdrawal, especially if you have used it for a long time or in high doses. To prevent withdrawal, your doctor may lower your dose slowly. If you experience any withdrawal symptoms, tell your doctor or pharmacist right away. Though it helps many people, this medication may sometimes cause addiction. Use this medication exactly as prescribed to lower the risk of addiction. And if this medication stops working well, talk with your doctor about different dosing options. Remember to tell your doctor if your pain does not get better or if it gets worse. Some common side effects of morphine sulfate suppository, Rectal may include nausea, vomiting, dry mouth, constipation, increased sweating, lightheadedness, dizziness, or drowsiness. To prevent constipation, it is important to eat dietary fiber, drink enough water, and exercise. You may also need to take a laxative, so it's best to ask your pharmacist which type is right for you. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential risks of side effects. However, it's important to notify your doctor if you experience any serious side effects such as interrupted breathing during sleep, mental or mood changes, vision changes, slow or fast heartbeat, difficulty urinating, severe stomach or abdominal pain, or signs of your adrenal glands not working well. Seek medical help immediately if you experience very serious side effects such as slow or shallow breathing, fainting, seizures, severe drowsiness, or difficulty waking up. While a serious allergic reaction to this drug is rare, it's important to seek medical help if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects, it's best to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Morphine sulfate suppository, Rectal is a medication that is used to treat severe pain. It is important to use the smallest effective dose for the shortest possible time to reduce the risk of abuse, addiction, and overdose. It may also cause severe breathing problems, especially when starting the medication or after a dose increase. It is important to talk to your doctor or pharmacist about having naloxone available to treat opioid overdose and to learn about the signs of an opioid overdose and how to treat it. Using morphine sulfate suppository, Rectal with alcohol or other drugs that can cause drowsiness or breathing problems may cause very serious side effects, including death. It is important to know how to use morphine and what other drugs to avoid taking with it. If you experience slow/shallow breathing, unusual lightheadedness, severe drowsiness/dizziness, or difficulty waking up, seek medical help right away. It is also important to keep this medication in a safe place to prevent theft, misuse, or abuse. Women of childbearing age should talk with their doctor about the risks and benefits before using this medication. Using it during pregnancy may slightly increase the risk of birth defects, especially if used during the first 2 months of pregnancy. Using it for a long time or in high doses near the expected delivery date may harm the unborn baby. Babies born to mothers who use this drug for a long time may develop severe withdrawal symptoms. If you notice any symptoms in your newborn baby, such as crying that doesn't stop, slow/shallow breathing, irritability, shaking, vomiting, diarrhea, poor feeding, or difficulty gaining weight, tell the doctor right away. Before using morphine, it's important to let your doctor or pharmacist know if you have any allergies to it or other opioid pain medications. This medication may also contain inactive ingredients that can cause allergic reactions, so it's best to discuss this with your pharmacist. Before using this medication, make sure to inform your doctor or pharmacist about your medical history, especially if you have any brain disorders, breathing problems, gallbladder disease, kidney disease, liver disease, mental/mood disorders, or a personal or family history of substance use disorder. It's important to talk to your healthcare provider about any stomach/intestinal problems, disease of the pancreas, or difficulty urinating. This medication may cause dizziness or drowsiness, so it's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Avoiding alcoholic beverages is also recommended, and it's crucial to talk to your doctor if you are using marijuana, cannabis. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this medication, especially confusion, dizziness, drowsiness, and slow/shallow breathing. If you are pregnant, this medication should only be used when clearly needed, as it may harm an unborn baby. It's important to discuss the risks and benefits with your doctor. This drug can also pass into breast milk and may have undesirable effects on a nursing infant, so be sure to inform your doctor if your baby develops unusual sleepiness, difficulty feeding, or trouble breathing. Consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include certain pain medications, naltrexone, and samidorphan. Using this medication with other products that may cause drowsiness or breathing problems could increase the risk of serious side effects. Be sure to inform your doctor or pharmacist if you are using other products such as opioid pain relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Also, check the labels on all your medicines, as they may contain ingredients that cause drowsiness. It's best to ask your pharmacist about using those products safely. Additionally, this medication may interfere with certain lab tests, so make sure lab personnel and all your doctors are aware that you use this drug. If someone accidentally swallows morphine sulfate suppository, it can be harmful. If the person shows serious symptoms like passing out or difficulty in breathing, give them naloxone if available, then call 911 immediately. If the person is awake and has no symptoms, contact a poison control center right away. In the U.S., you can call 1-800-222-1222 for the local poison control center. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include slow/shallow breathing, slow heartbeat, extreme drowsiness, and coma. It is important to take morphine sulfate suppository, rectal exactly as prescribed by your doctor. Do not increase your dose, take it more often, or use it for longer than prescribed. This medication is typically used for the relief of severe pain. The dosage is based on your medical condition and response to treatment. It is recommended to use this medication at the first sign of a bowel movement to get the most benefit. The optimal timing for taking this medication is usually first thing in the morning. Be sure to follow your doctor's instructions carefully. It's important to remember that this medication is prescribed specifically for your condition and should not be shared with others. Also, it should only be used for the condition for which it was prescribed, unless your doctor instructs otherwise. If your condition changes, a different medication may be needed. If you are using this medication regularly and happen to miss a dose, just take it as soon as you remember. But if it's almost time for your next dose, then it's better to just skip the missed one and continue with your regular dosing schedule. Avoid taking double doses to make up for the missed one. It's important to store morphine sulfate suppository, rectal at room temperature away from heat, and keep it away from children and pets. Do not flush the medication down the toilet or pour it into a drain unless instructed to do so. When it is expired or no longer needed, be sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.